Let's talk about that moment, that critical, heart-stopping moment when a patient arrests. Do you and your team feel completely confident you know the absolute latest, evidence-backed steps to take? Today, we're diving into the huge 2024 Recover updates for veterinary CPR. And trust me, this isn't just a refresher. These are real, practice-changing guidelines that can make all the difference.
First off, let's be really clear about what RECOVE actually is. It's not just some random set of recommendations somebody thought up. Nope, this is a massive international consensus, a true global standard of care. It's built on the most current, hard evidence, and it's all about one thing: improving survival rates for our dogs and cats.
And to get a sense of just how big this is, look at this number. Over 80,000 veterinary professionals around the world are Recover certified. So yeah, this is not some niche guideline. It's the unifying framework for how our entire profession tackles resuscitation.
So here's how we're going to break it all down today. We're going to walk through this just like a real emergency. We'll start with the why behind Recover, then jump into those first critical seconds, master basic life support, then really dig into the key 2024 updates for advanced life support. And finally, we'll talk about how to make all of this become second nature for your team.
Okay, so let's start at square one. Why should every single person in your clinic, from the brand new tech to the most seasoned surgeon, live and breathe these guidelines?
Well, simply put, the RECOVRI initiative gives us the only evidence-based CPR guidelines in veterinary medicine, period. They first came out back in 2012, and now they've been completely updated with all the latest research to give our patients the absolute best shot at survival.
Okay, now let's put ourselves right in that moment. A patient collapses. The clock is officially ticking. And those first 10 seconds, they are absolutely pivotal. They set the entire stage for everything that comes next.
This sequence right here, this needs to be pure muscle memory. You call for help and start assigning roles immediately. You check for responsiveness and breathing. Then comes the pulse check. And listen up, this is key. You get 10 seconds maximum. If you have any doubt, any hesitation at all, you start compressions. Remember this, the risk of waiting is way, way higher than the risk of compressing a heart that might still be beating.
All right, now let's get to the absolute foundation of any resuscitation: high-quality, basic life support. This is all about technique, and it's the bedrock everything else is built on. You know, high-quality CPR really boils down to three numbers your whole team needs to know by heart. The rate, 100 to 120 compressions a minute. Yep, think of the beat to staying alive. The depth, you're going to compress 1/3 to 1/2 the width of the chest. And recoil, you have to let that chest fully expand between compressions. That recoil is so important. It's how the heart refills with blood.
Here you can see the cardiac pump theory in action. This is your go-to for most dogs. See how the hand placement is directly over the heart with the patient lying on their side? You are literally physically squeezing the heart to force blood out. But it's not one size fits all. What about our barrel-chested dogs, like bulldogs or mastiffs? For them, we completely switch gears to the thoracic pump technique. You can see the patient is on their back, and we're compressing over the widest part of the chest. Here, instead of squeezing the heart directly, you're changing the pressure in the whole chest cavity to move blood. It's way more effective for their specific anatomy.
And for cats and our really small dogs, the technique changes yet again. This image shows that circumferential grip. You are literally wrapping your hand or two hands around the sternum and squeezing the heart between your thumb and your fingers. This gives you incredibly direct and effective compressions.
Okay, this is where we get into the really big stuff. These are the most significant evidence-based changes from the 2024 update. Your team needs to review these and put them into practice like yesterday.
So, what are the biggest, most practice-changing recommendations for 2024? Well, they really fall into two main buckets: our drug protocols and how we handle defibrillation. Let's break them down.
All right, let's start with what is probably the biggest change. High-dose epinephrine is out. It is no longer recommended. The evidence is now clear that it may actually be linked to worse outcomes. The standard low dose is the protocol now. And I know that's a huge departure from what many of us were taught for years.
Here are the numbers you need. This table has the exact updated drug dosages for 2024. And here's my advice. Print this slide out and tape it directly to your crash cart. In a code, you do not want to be trying to remember these. Notice that standard epidose and the really important single-dose recommendation for atropine.
And there are two other major changes to flag. First, atropine's role has been narrowed down a lot. It's now recommended as a single dose and only when you suspect the arrest is due to high vagal tone. Second, and this is another big one, for shockable rhythms, we now defibrillate first. You deliver that shock before you even think about reaching for the epinephrine.
So knowing all these guidelines is one thing, right? But performing them perfectly under incredible pressure, that's a whole different ballgame. And that's why this final part is so incredibly important for your team's readiness. And hey, don't just take my word for it. This quote from the Recover Committee says it all. They strongly recommend simulator-based training to build motor skills and team coordination. This isn't something you can just learn from reading a textbook. It has to be practiced until it is pure, ingrained muscle memory. You know, it's about so much more than just knowledge. It's about building a coordinated, confident team that can act decisively and effectively together. Regular drills, clear communication, and postcode debriefs, that's what transforms these written guidelines into life-saving instincts.
So, all of this brings us to the final and honestly the most important question you can ask. Is your team truly ready for the next code? What's your plan to train, to practice, and to get these crucial updates implemented? Because when that moment comes, readiness isn't an accident. It's the direct result of preparation.